All right, thank you, Gary. Good morning, everybody, and welcome to the Paramedic Services Committee of Wednesday, May 21st, 2025. Attendance has been taken. We've had no regrets. We're just, usually Councillor Hunt Zooms in, so she may join us later, but everyone else is here. So I'll allow us to get started. Item 2 is approval of the agenda. Does anybody have anything they wish to add under other business? Okay, see no hands. Can I get a mover for that agenda for today? Moved by Councillor Pierce, second by Mayor Davis. Good enough. All in favor? Opposed, if any? None? Okay. Any declaration of pecuniary interest? Okay, seeing none. We'll go down to, we'll skip 4 because we don't have any delegations. Adoption of minutes from previous meetings, and that would be the last one from March 26th. Can I get a mover to put that on the floor, please? Moved by Mayor Bailey, second by Councillor Pierce. Any errors or omissions? Okay, I just see one, and to our clerk. This is under, this is on page 8 of our package. Item 9, other business. It says, in response to questions, Cindy Stevenson advised the new fire admin hall occupancy will be 2-phase, and I think that's not fire admin, I think that's the paramedic. Oh. That would be my guess.
I believe that is correct.
Yeah, so just that's the only correction I see. So no other corrections or questions on it? All in favor? None opposed? Okay, thank you. What about now? Okay. Okay, so we will go down to any business arising from those minutes. Okay, see none. We'll go to the first one, staff report, and that's a construction status update. And that's for information, and Cindy has been giving that to us every meeting now since requested, which is greatly appreciated. Can I get a mover on the floor to receive that report? Moved by Mayor Davis, second by Councillor Martin. Any questions for Cindy on that report? Go ahead.
Thanks, Mr. Chair. Through you, just a couple quick ones. So in regards to the potential of having to move the building 1.5 meters due to the boundary indications, can we just get an update as to where that stands? Is that something that has to be done or is going to be done, or is there any way around it? I'm just curious.
Through the chair, so that is proceeding, and the architects are submitting a site plan amendment to the City Planning Department. We have had conversations with City Planning and don't expect there to be any issues with that amendment. So construction is continuing to proceed as planned.
Okay, so follow up, Mr. Chair, and I think that's the key there is the fact that, you know, it kind of states it in here, but I wanted to just hear it. It's not going to delay anything. Beginning construction, everything is all good, and as far as square footage, everything's going to be the same.
Through the chair, that's correct. We're not anticipating as a result of this, and the footprint, everything stays exactly the same.
Okay, thank you. And one further one, if I have, Mr. Chair. When you talk about in there with the tariffs and that sort of thing, you speak of the high-speed roll-up doors. I know you're looking at, it says domestic manufacturers are being pursued. I'm assuming that there's somewhere in Canada that would make these things. It doesn't mention any others other than down below it talks, there is a risk that tariffs could impact project costs. Well, that's the only one that's noted in here. Is there anything else that we're aware of at this point in time, or we think we should be okay?
Through the chair, that is the only item that the construction manager has identified at this point that could be impacted by tariffs. We had a biweekly construction meeting yesterday, and that question came up, and at this point in time, they're not identifying anything else.
Okay, good to know. Thank you very much.
Okay, any other questions for Manager Stevenson? Go ahead, Councillor Martin.
Yeah, have you looked at the doors they used at Fire Station 2 in Brantford? The kind of bifold doors that open fairly quickly. They surprised me when they opened them, how fast they opened. Might be an alternative to a roll-up door.
Through the chair, they actually have identified a provincial manufacturer for these doors, and it does sound like we will be proceeding in that direction, but I believe that our Deputy Chief Vanderpost wanted to go on site and take a look at them before we make that decision, but it is promising that we'll be able to bypass a $60,000 tariff and find something locally within the original budget.
Good suggestion. Any other questions for Cindy? Okay, so the two questions I had to scratch out because they were asked, so thank you for that. Our next paramedic meeting is in July. Do you see, would it be possible to get a tour or anything like that prior to the grand opening?
Through the chair to the chair, I'm sure that we could make that happen as long as everybody who's on site has the proper protective equipment.
Okay.
So we'd need safety shoes, hard hats, which we could source out, I'm sure. But we just need to make arrangements with the contractor for that.
We did that for the OPP station. It was neat. It was good to see it prior to it being open. So, but you and I can take that offline and maybe figure something out and then let the other committee members know. So, okay, seeing no other questions then for General Manager Stevenson, all in favor of receiving that report? Okay, thank you. And now, Councillor Hunt, I didn't miss you for a question, did I? Okay. You're just below my screen, so I'll have to move it periodically. Okay, we're moving on to item 7.2. This is a multi-service sector accountability agreement, and this is dated April 1st, 2024 to March 31st, 2025. So note that that's a different date than the one we passed last meeting. So can I get a mover to get this on the floor? Moved by Councillor Pierce, second by Mayor Bailey. Any questions, comments, concerns? Go ahead. Councilor Pierce.
Thanks, Mr. Chair. So when it talks about the community paramedicine program is eligible to receive up to $304,358 in funding, do we know what we will be receiving? Is there a final on that? And is there anything that we can do to, if it's below that, is there anything that we can do differently in order to bump it up at all?
Through you, Mr. Chair, we'll find about our funding models usually August. The government hasn't really convened at this point in time. Our funding letters are always late, but Deputy Chief Kinane has already applied for other funding avenues to increase the existing budget that he had. So we'll find out more about August. It's basically business as usual as it has been in previous years.
Right.
And then we'll find out about our funding letter later on.
Okay. I guess my question here is that, it says the funding year is up to March 31st, 2025. So even though it's past that, we won't hear anything until August? Or just status quo until we hear?
Through you, Mr. Chair, it's the same as a dedicated offload nurse program. It's status moving forward. We do business as usual. If there's any changes and stuff like this, we would have heard rumblings from different parts of the ministry. We have not. But it's in previous years, I think this has been ongoing for the community paramedicine for the last 7 to 8 years.
Yeah.
We find out about June, July, sometimes August with our funding letters.
Right. And one final one, Mr. Chair. You just spoke of looking at other possible revenue resources. Is that something that we're going to continue to do regardless how much we get here?
Through you, Mr. Chair, there's always programs that come out through different long-term care, different associations. We continue to look for different programs. The concern we have right now with asking for too much is trying to be able to apply that out there, dealing with some of our staffing crunches and the shortage of paramedics throughout the province right now. We're just trying to maintain our existing 911 staffing before we expand out to any further programs.
Okay, thank you.
That, the provincial funding, I was on the paramedic committee 10 years ago. We had the same debates back then, and that was for offload nursing. And you would commit to a certain funding, But you wouldn't know about the province until 6 months after the fact. But I think if we don't get it, we're going to hear, so. And then we'll have to sit down and put our thinking caps on. So any other questions on that one? Okay, see none, I'm going to call the vote. All in favor? Opposed, if any? Okay, see none. Okay, thank you. That brings us to 7.3, and that's the, and this is our inaugural, I guess, annual report, right? So I'll get a mover then to get it on the floor, and that's to receive for information. Moved by Mayor Bailey, second by Councillor Hunt. Okay. Russ, did you want to speak to it first? Was there anything you wanted to highlight that's not highlighted in the report?
Through you, Mr. Chair, this was a conversation that General Manager Cindy Stevenson and myself have had for the last couple of years. It would be a good idea to put out an annual report. And I have to give credit to our admin assistant, Kim Tucker. She put a lot of the data, the statistics and everything else, and putting this package together to put the first annual one through. I think she did an excellent job. And I have got to give her credit for what we basically were able to produce in these 18 pages.
Any questions for Russ or General Manager Stevenson on that first ever annual report? Go ahead, Councillor Pierce.
Thanks, Mr. Chair, through you. Yeah, it's great information there so it's on page 10 of the report for performance. When it has the breakdown of the calls by different stations, I'm curious, is that, because Henry Street has more. So I'm curious, is it the fact that Henry Street is the closest unit to whichever call's coming in? Or is it the fact that because Henry Street potentially has more units there, that there's more calls from that station? I'm just trying to understand the breakdown here. Obviously I know we send, like, for example, if there's something in Paris, if there's a unit at the Paris station, then it'll go from there. I'm just trying to understand number of units available at these different stations, if that has a factor on the total number of calls for that particular station.
Through you, Mr. Chair, Henry Street is basically what we refer to being in the core, where a majority of the call and the call density is. We have 2 vehicles running out of Henry base. The next busiest base is Colburn Street over in West Brant. They're doing about 8,600, as well as they have 2 vehicles out of that same station. Tranquility has 2 vehicles out of that one at the same time. But when we're going down to Canesville assists Henry. So if you had that truck that is currently in the Canesville, previously the old fire hall, and added that vehicle into Henry, right? Those calls would basically go up to Henry, and Henry would be about a 12,000 call area in that. So it was a combination of the number of vehicles and also where it is located.
Okay, and thanks for that, Russ. Can you just, sorry, how many units are at Canesville?
One,
and then there's 2 in Paris?
1.5 in Paris. There's a 24-hour car in Paris, and then there's a 10 to 10.
Perfect. Thank you very much.
Okay, any other questions? I just have one. I like this report. There's nothing in here that surprised me, let's just say. But then I sit on the paramedic committee. I read every single thing that comes before us. So, but it was a good summation of the year. And if we're trying to get information out about, for example, how many calls come out of Henry versus, say, Colburn versus Paris or things like that, it's a good way to communicate it to the rest of our councils and to the public at large. So there was one sentence about communication, but I just wondered, maybe Cindy, could you elaborate a little bit on how we can communicate this to everybody else?
Through the chair, to the chair, we have looked at a communications plan for the report. So once it's received by committee today, and if there are no recommended changes, Russ will first communicate it out to our staff group, so they have the opportunity to see it. It will be placed on our website, and we're also sharing it with our key partners, so all the other emergency service partners, the Brant Community Healthcare System, Graham Energy. So if there's any other suggestions in terms of the communications plan, I'm certainly open to that. But I think it's a great opportunity to highlight all the good things that are happening in the service and be transparent and accountable to the public as well.
I appreciate that. I'm always thinking a little bit down the road, and I think something like this, when people see the pressures placed on the service, the general public will understand. It will help in getting the message out that when we do, fund the paramedic services, sometimes by double-digit increases, at least people will have an understanding of it. So, Mayor Davis.
Along the same lines, Chair, and through you, we know from past experience that one of the most significant issues we have that challenges the resources available are people calling for an ambulance when maybe they should be looking at some other option. So we'll call those the less urgent calls, which probably runs at anywhere between 10 to 20% of the overall call volume. And much of that is because, one, they don't have a family doctor, and two, if they don't have a family doctor, they don't know where to go. They're not aware that there are now clinics that are opening and being expanded with the new provincial program. So I'm wondering if we should also include in our messaging something about that, and including in that the fact that there are now expanded clinic capacity in the city, I suspect also in the county. So people have that information. Oh, I didn't know that. I didn't know there's this clinic that I can go to, and like a walk-in clinic.
Could we get an amendment?
I guess you wouldn't normally see that in an annual report, but
Yeah.
certainly I think we should be trying to include that in our messaging.
Yeah, go ahead.
Yeah, through the chair. This is noted in a later report, but this certainly is a challenge experienced not only by us, but all the paramedic services in the province. And we do participate in the Emergency Services Steering Committee, which has been working on a campaign on 911 reduction. And that subgroup just released that campaign within the last couple of weeks, and we are participating in that. And we have started in tandem rolling out that messaging through our media channels to try to assist and mitigate and educate the public on when to use 911 and what alternatives are available. So we're actively participating in that currently, and we'll continue to do that. I expect that there's a whole package of campaign materials, and we're sort of releasing those as the bigger committee releases them as well.
But Cindy, that would be part of a provincial campaign, right?
It is, through the chair, a provincial campaign, but all of the participating municipalities within that Emergency Services Steering Committee are part of that, and we're all sort of working together to launch that information out there.
Right. Because what I'm getting at is I appreciate that the provincial campaign that you're part of explains, when you call 911 and when you don't, and if you're not going to call 911, what your options are. But I think it would help locally if it includes what specifically those options are here in the county of Brantford, the city of Brantford, because they are expanding now. The Ministry of Health has been allocating more funding towards expanding clinic capacity and walk-in clinics, and I think we're beginning to see that in Brantford, that generally that there's increased availability, but I don't think people generally are aware of it.
Yeah, through the chair, I think that's a great suggestion, and we can look at incorporating that information as well.
Yeah, I appreciate that, because we can customize the information on top of what everybody's trying to do across the province. I think that's what you're getting at. Do we need an amendment, or is that good for staff direction? You okay with that? Okay. Good. Okay, any other questions? See none? Okay, so on that, first annual report, all in favor of receiving? Okay, that's passed. Okay, we're gonna go to 7.4, Paramedic Services Budget to Actual Variance at December 21st, 2024. Heather has a final number on that. I'm gonna ask for a mover to get that on the floor to receive that information. And Councillor Pierce, thank you. Can we get a seconder? Councillor Martin. Any questions for Heather on that? Okay, seeing none. Heather, that number that we have in front of us, that's the same one we had prior, correct?
Through you, Chair. It is a little bit higher. We did take a second look at the cross-border and did have to adjust that number up. So the overall number has increased slightly.
Couldn't go a
Sorry.
little lower. Okay, that's unfortunate. But we understand why, and we appreciate at least you pointing that out. Councillor Pierce.
Thanks, Mr. Chair. That was one of my questions is the fact with the, like, 34,000, that's not one or two. Like, can I ask what happened here? Like, I'm just curious how, were we out, was it not documented, or I'm curious as to how we were out that much?
Through the chair, the cross-border billing adjustment was further look at the agreement that we have with Six Nations on cross-border billing. There was a lack of understanding on the agreement that we have with them currently. So we do have a 10-year agreement with them. I think both Six Nations and the Brantford Paramedic Service, we're kind of moving in a different direction, but that agreement clearly outlines what we're responsible for in terms of payment. So that's what's been incorporated into the final adjustment.
Okay. All right, so this is, it's what was in the agreement, and that's where we're going. Okay. Thank you.
Okay, any other questions for our treasurer at this time? Okay, seeing none, I'll call the question to receive. All in favor? Opposed? Okay, that's approved. Okay, this takes us down to item 7.5, and this is the Paramedic Services Budget to Actual Variance at March 31st, 2025. And I certainly look at these reports in a little different light in light of what we experienced last year. So I'll get a mover to receive this as information by Mayor Davis, second by Councillor Martin. Any questions for Heather at this time? Okay. Yeah, go ahead, Mayor Davis.
So we're doing better this year. Why and how?
Why and how are we doing better?
Through you, Mr. Chair. At this point in time, at the end of March, we do look okay. I would caution that there's the biggest increase is related to staffing, which the April 1st is both the non-union cost of living increase and the OPSU increase. So those aren't in the budget numbers or in the actual numbers from January to March. By the end of the second quarter, that impact will be felt, and it'll bring that bottom line more in line with the budget. There is some caution around other budget pressures as well.
So you didn't customize the quarterly budget projections to that particular circumstance?
Through the chair, this is actuals. It's not a projected actual. Like haven't done a projection to the end of the year.
Yeah, but when you did the projected actual, you did it based on the total annual payroll divided by 4?
Yes.
Yeah, okay.
Go ahead, Russ, if you want to add.
So we have a little bit of we're forecasting that if the last 4 to 5 years, we've had a 6 to 7% increase in calls every year, we're going to look at that moving forward. We did change our agreement with our oxygen supplier and a few other items that we're working on. So we're trying to make the improvements mid-budget year of 2025 so that our operational impact is not as significant.
Any other questions? Yeah, it is a little frustrating, but the way I see it, if we're doing road work and we go over our budget, we can stop. If we go over the paramedic budget on December 3rd, we can't stop. You still have to keep going. So that's a little bit of the difference there too. So, but you guys are paying much more closer attention to it this year. And it's not that you didn't pay attention to it last year, but given the surprise we had, it's maybe under the microscope a little more.
Through you, Mr. Chair, the 2,500 additional calls is basically, looking at our chart, is 1 full month of calls. So if we stopped November 30th, those 2,500 is going into December.
That's why I said December. I figured around early December, so. Okay, any other questions then on the variance to budget? Okay, seeing none, all in favor of receiving? All opposed? None? Okay, this brings us to item 7.6. This is the paramedical services statistical package, and this is for information. So I will ask to get it on the floor. I'll look for a mover. Moved by Mayor Bailey, second by Councillor Martin. Russ, do you want to touch on anything in there?
First thing I want to touch on is the offload delay times. The 45-minute on average on one of the pages is basically the best we've seen since 2022. Our code zeros, yes, our data was corrupt as of the 20th of April. Kim did make a note in our overall statistical report, but even if you averaged it out, it would have only been up to about 62 code zeros. From the height of some of our code zeros were in the 200 and 300 mark. We are continuously working with the hospitals for our overall improvement. A good measure for us is for the offloads and the amount of work that our medics are doing. Our meal claims in some months previous, before the ministry came in and gave us a hand, was about $9,000 a month. We're down to about $2,400 a month, which that means the crews are getting more downtime, more meal breaks. I guess the combination between the code zeros and the offloads, the code zeros, if we have less of those, our cross-border billing calls should also go down. We currently have agreements with all of our surrounding areas except for the 10-year agreement, as Cindy referred to, for Six Nations. We call it a wash. We don't have cross-border agreements with our other partners. We help them, they help us, and there's no additional cost to us. And it's also Paramedic Services Week every year. They recognize paramedics, so this week we planned some different events for the medics. What we've had a lot of success for is providing lunch to them, either being dairy delayed or pizza or whatever the case is, just as they're working to show our appreciation of all the hard work they've done.
Okay, thank you. Questions for Russ on his statistical package?
I do have one more. Go ahead.
Yeah, Councilor Pierce?
Thanks, Mr. Chair, through you. And you touched on it there, Russ, in regards to the hospital offload times, like best we've seen in a few years there. So, and I don't want to put this across as a bad thing, because this is good news. We're definitely, trending in the right direction for sure. But I'm curious, because we had the offload nurse and such in 2024, and I'm just curious, like, 7 minutes, doesn't sound like a lot of time, but it is a lot of time. Are we doing anything differently other than potentially, how can I put this, potentially having that offload nurse available when we need them to bring that down? I'm just curious, are we, if I can, for lack of better words, are we finally starting to get what we're paying for in these offload nurses, or are we doing something else different as well to draw that number down?
Through you, Mr. Chair, I don't think it's what we're paying for is what we're getting. I believe with the hard work from the ministry, and there's a nurse out of North York General that came down, it's a complete culture shift, right? The culture between the nursing staff, our patients coming in, the overall medical responsibility of these people. I think the hard work from the ministry, the BGH itself, has been a culture shift. If you wanted to put dollars for dollars, whatever the case is, they were doing their job before, but now they're looking at it in a different priority to show that we're a priority, that they're finally realizing that if we've got 8 vehicles stuck in the emergency department, there's nobody else out there for their community members. So I think it's a culture shift, the hard work and the direction of management there, and working with us and the ministry to come up with solutions is what has been our success.
Okay, and that's, like I say, that's great news, and thanks to all that were involved with that. But like I say, we kind of spoke around this table before in the fact that, you know, there needs to be a mentality change in the way that they're thinking things. So from what I'm hearing, they're starting to buy into the fact that, you know, that your team is as important, if not, you know, and I don't mean any diss to anybody in the emergency waiting room, but a little bit more important than those that are sitting in the waiting room to offload that patient to get that unit back out. So that's a good news story, and again, thanks to all those that were involved with those talks to shift that. So I think, you know, I look forward to these numbers going down even more as they continue to catch on and continue to see the numbers, which would indicate to them that, you know, whatever they're doing now, whatever they've changed is working. So thanks.
I agree with your comments, Councillor. The overall management change to there at the Brantford General Hospital has greatly assisted us. They had a couple change in managers in the ER department, and now with the new CAO there there's more stability, but they're working towards the culture shift as well.
Perfect. Thanks, Russ.
Okay, we're going to go to Mayor Davis next.
Following that line of questioning, I found the most interesting data is that last set of data that shows the total lost hours in ED offload, then the next column, total code zeros, longest episode, and we can see, if you use that chart, you can see very dramatically just what was going on last summer. And code zeros running at well above 200. And then through the fall, you see the ED offload time dropping dramatically. So my question is, and in fact, you start to see it in September, when did the Ministry of Health, when did they get involved?
Through you, Mr. Chair, they started having conversations with us back in May and June of 2024.
Okay. And they actually brought a nurse from the GTA in to assist?
Through you, Mr. Chair, it's a very unique story. The nurse is from North York General. That's basically what kind of witness do you call that's like for the defense or whatever the case is, expert witness? She used what she learned from her legal cases and applied it to her department, and they noticed a huge increase in offload delays and switching the culture. The Ministry of Health promotes us to reach out to her. Hamilton did it, and they removed a great amount of their offloads. We thought we'd try. It's just getting the two parties talking that it's almost like rumors that you're responsible if this happens and you're responsible, right? She comes in, lays down the actual litigated laws and everything else, medical responsibility and stuff, and people start seeing that it's not just like, well, that's not my patient, that's not my patient. The paramedics can watch this patient. Once they cross that threshold, that patient is the hospital's. So with her program, it helped with a complete culture change, and we're telling our other surrounding services like Oxford and Norfolk right now, they're starting to see a little bubble in their offload times to bring her in. She just actually presented at our OAPC conference last week to all 50 plus EMS services that if you're struggling, bring her in. And she went through about a 2-hour presentation of what needs to be changed for culture.
So legal shock therapy.
In a roundabout way, yes. But however, she is not compensated from our service or the Ministry of Health. She comes in, allows everybody to learn what's next, and they can build on the tools that she provides them.
And is the ministry still providing this assistance, or is it still assisting in dealing with the issue?
Through you, Mr. Chair, yes, the ministry is sticking with us until the offload times are greatly improved. We call it greatly improved, but they want to see additional improvements.
Okay. And if I'm looking at that chart, one thing I thought that might be helpful in convincing everyone as to the benefit of what's going on is if you can, is it possible to include the cardiac arrest percentage response rate for each of those months? Like, I assume you're going to see that the sudden cardiac arrest response for those months of, you know, May, June, July, August, I suspect it declined considerably. Logic would say that it did. And can you add that into the monthly analysis?
Through you, Mr. Chair, yes, we can break it down per month. On our annual report, like we did for 2024, we did 417. We can extract that data and do it on a monthly basis. But now that you've brought that up, if we look at our benchmarks, is the other thing I wanted to add, is in cardiac arrest, our benchmark is 60% of the time. We're only at 35. I've been working with General Manager Stevenson and Deputy Chief Kevin Robinson on a new deployment plan to use ERVs out in the community for more of a rapid response to deal with that, to see if we can improve those numbers up to our current benchmark. I believe we will have a report to be presented to this group in the July meeting.
Yeah, what I was thinking how it can be used is if you're trying to create a culture change about it for everyone that's involved, I think almost everybody understands this issue of sudden cardiac arrest and how it's critical that somebody, that a paramedic be able to attend within that benchmark time, right? And if you can show that during the period of time that the offload times were, you know, really out of control, out of whack, you could see a corresponding shift in the sudden cardiac response. I mean, it's part of the case of, look, to reduce those offload times is going to have a dramatic impact on all of the data, all the response times, which means more people being saved, right?
Correct.
And that's a pretty persuasive telling story that if the data bears out and if you can include that additional data point.
Correct. I do agree 100%. If you look at our 400 last year, divide that by 12 months, right, we were doing at least 8 to 10 a month.
Yeah.
Right? No, more than that. It would be 412 divided by 12 would be 36 a month.
Yeah, because you see that in the data you do have there in the code zeros, like the code zeros running at, you know, 220 per month last summer, and now getting back down to, looks like an average around 100. I mean, that's a dramatic improvement.
I'll work on it with General Manager Cindy for messaging regarding that and taking that data and see how we can improve it.
Okay, thanks.
Thank you.
Okay, thank you, Mayor Davis. Any other questions for the chief? Okay, seeing none, just one from myself. The work that went on at the emergency department, has that improved or had any impact on offload delays that you're aware of?
Through you, Mr. Chair, the hospital's been working well with us to get our vehicles and our staff in and out. There hasn't been any significant delays. The emergency main entrance is now completed, and they're working on the next stages.
Okay. We'll see. And then somewhere down the road, we'll have a new hospital, so. If there's no other questions for the chief at this time then on his report, I'll ask show of hands, all in favor of receiving that report. And opposed, none? Okay, thank you. Communications, we have none. Nobody listed anything under other business. When I asked, I'll ask one more time. Anybody have anything under other business? Seeing none. Nothing in camera. This will take us down to item 11, next meeting, July 6th, 2025. Now, I know the city, July 16th, 2025. I know the city, you guys usually take the month of July off, but hopefully you're not too far away. And if we can get a tour going, we'll ask members of the committee, maybe members of council as well, if we can go have a tour, so. We should have furniture by then. Okay. Well, if we don't, we don't. Let's move on. So, okay, on that note,